Hello, everyone. I'm Eric Sullivan. Excuse me. I'm a family physician here in Chicago, and I'm currently the chair of the Access to Affordable Care Impact Area. Um, and so, obviously, very excited to give this presentation today, and happy to engage with you around access to affordable care in general. If that's something you might be interested in after the talk, feel free to reach out. So objectives for today, pretty straightforward. So going to be explaining the importance of effective public health messaging. We're going to identify components of an effective public health message. And then we'll also have a conversation around barriers to communicating your message, regardless of the audience you're giving it to. So I know this audience will probably not need a lot of convincing about the importance of public health messaging. But I just wanted to highlight a few examples of some successful efforts in the past, both to get us motivated to know that change is possible, but also to just kind of show the different timelines in which change can sometimes happen. And so one that I think that many people don't think about as much these days is seatbelts. And so as recently as 1980, the percent of people in the United States using seatbelts was only 11%. And in 1990, the year I was born, that had only gone up to 49%. So less than half of people were still using seatbelts at that time. But most recently, as of 2023, that rate is now over 92% of people using seatbelts. And so I think that just highlights how dramatically things can change over time in terms of what's considered normal, quote unquote. And so, I think it had someone been approached at random in the 1980s about, wearing seatbelts and telling them hey, did you know at some point in the future, virtually everyone will be wearing seatbelts? Probably random person on the street would not have believed you, would have been like, yeah, there's no way that you're going to convince enough people to do that. And lo and behold, now it's definitely the outlier when you see someone driving without their seatbelt on, thankfully. And so, another example that people, probably more quickly comes to mind is smoking. And so, this is, again, always blows my mind whenever I look at these statistics going back far enough. But as of 1965, which was the earliest that I saw on the CDC website, the rate of smoking at that time was 42% among American adults, which is, just a terrifying number. But as of 2018, that number had gone down to 13.7%, and has continued to fall in the years since then. And obviously, smoking, probably one of the biggest public health campaigns that the United States has ever undergone, period. And lots of policies have been implemented around smoking that have contributed to that. But it's undeniable that public health messaging, just by itself, has obviously played a big role in just increasing the awareness around the dangers of cigarettes. So now those dangers are pretty ubiquitous. Even people who are still smoking recognize the harms that they're doing. It's sometimes just very challenging to quit. But the level of penetration of the message around the dangers of smoking is near universal, which I think is a real testament to the power of public health messaging when it succeeds. And then obviously much more recently, during the COVID vaccine campaign, I think that this is one that surprises a lot of people, certainly surprises me every time I see these statistics, just knowing the level of division that we saw around the COVID vaccine after it was developed. But the percent of adults, I should say, who have received at least one COVID vaccine is 92%. And even taking it to the percent of people who received the full initial dose, the full initial regimen, which in many cases was 2 doses for a lot of people, that was almost 80%. And so just knowing that, almost 4 in 5 Americans were persuaded to get that initial COVID vaccine series at the height of the pandemic, when it was probably most important. Not that it's not still important to continue being vaccinated, but obviously at that time even more so. I think is just a real testament to to what can be accomplished in a short period of time. And that's even the case for something that I think internally these days we obviously think as being probably one of the most polarized public health issues that we're dealing with around COVID. So some interesting examples there. And so, those are obviously kind of more general. I did just want to kind of highlight specifically when we're talking about the importance of public health messaging around this topic. And again, not an audience that I probably need to do too much convincing. But obviously, in the states that have not yet expanded, there's a significant proportion of people who don't yet have a good sense, or if they do, they have so far not been persuaded by the evidence supporting Medicaid expansion. So I just wanted to throw out a few quick factoids that I think may help persuade at least a few people in the months and years ahead. And so one that I think obviously still very resonant is Medicaid expansion's impact on the opioid epidemic. And so we've seen that in the states that have expanded Medicaid, that there's been a significant increase in access to medication-assisted treatment in the form of Suboxone, which is the brand name for buprenorphine and naloxone. And this is obviously really critical nationwide, but perhaps not coincidentally, some of the states that have yet to expand Medicaid are also some of the states still suffering the most with the opioid crisis. And so I think this could potentially be a very persuasive avenue in engaging around public health messaging on the topic of Medicaid expansion. But of course, there's going to be people who are still not super sympathetic to the opioid crisis and kind of drugs and narcotics issues more generally, more specifically. So you could broaden out the case to be made and look at still the leading cause of death amongst older adults, which is heart disease. And again, in states that have expanded Medicaid, there's been an association in reduced cardiovascular mortality, which is pretty incredible when you think of all of the things that don't improve cardiovascular mortality or don't have a positive association with it. The fact that we're starting to see some preliminary evidence to that end with Medicaid expansion states is really exciting, and again could help kind of guide the conversations going forward around Medicaid expansion. And then even more basic, I found some very powerful data around just pure like lives lost versus lives saved in states that have expanded versus held out on Medicaid. And you can see here from the graphic that there's, just countless, well, I guess countable, but many more lives than we would like to see being lost as a result of states not expanding Medicaid. And so this again could be something to have in that toolkit when you're reaching for examples of why this topic is so important when it comes to public health messaging. And so as we get into how to actually craft your message in delivering anything to do with public health, but obviously for the purposes of our discussion today, especially Medicaid expansion, just wanted to talk about a couple key principles that are not going to be surprising, but are still worth emphasizing. And so the first of them is when it comes to messaging is just keeping it simple. And that's true kind of regardless of the topic, but especially with something that can be very quickly wonky like Medicaid expansion, falling back on, very simple statements, broad concepts, using some of the, information I just presented, but in, very general ways, talking about ways in which there's building research that suggests that Medicaid expansion may very well like save lives in the states where it's happening. And definitely there's a risk of trampling on some nuance there. And of course we don't want to outright fabricate anything. But at the same time, certainly for those of us in the health professions who really like to be very specific with the data that we're utilizing, there can be a risk to getting too specific and losing people. And so, with something like Medicaid expansion, the simpler the message, the better. You just want to continue to keep hitting the most important points of why Medicaid expansion is so important. And then, another kind of guiding principle towards talking with others, certainly in a public setting more generally, is I think of when people are giving toasts at a wedding, and obviously a very high stress situation for those giving it, but hugely variable outcomes when it comes to people actually delivering a successful wedding toast. Um, and so, as with all good talks or presentations, want to bring some level of preparation to it. It's not to say that you want to be stiff and robotic about it, but having a good sense of where you're going is helpful because next thing you know, it's you're still talking through dessert and no one is listening to you anymore. Um, and of course, being brief. And this goes back to the keeping it simple, very much in the same theme. But when you're talking about any sort of message, the shorter in time in which you can give it, the more likely you're going to keep that person engaged throughout the topic. And that's not to say that there won't be people who want to engage with you in a more long form way, and obviously being prepared to have a more in-depth conversation is helpful. But I like to think of it in the same way that we talk to people about giving research presentations or people in the business world talking about pitches for their ideas. Crafting a message that you can then use in different amounts of time, whether that's 1 minute, 5 minutes, 10 minutes, is going to be really helpful because you may only have, that small amount of time to really get your point across, like in an interview, for example, with a local media outlet. They may just want your pithy few lines and not necessarily give you the time to really get into all the points you'd like to talk about. So as you're starting to get into this work and crafting your message, thinking about those different settings is important so that you can have them nice and finely tuned when you get your opportunity. And so, keeping on with the topic of how are you actually like delivering your message to different people. In medicine, it's, I think, a little ironic that when you get to medical school, you are probably a little bit more human than you are when you leave it, because at least in what I gathered from how we're taught, because there are many times in which you're just getting trained on how to talk to people like normal people, because it becomes increasingly difficult to do so as you get farther along in medicine. And so that learning how to continue to meet people where they're at is both important in medicine, but also just important in general, and nowhere more so than when you're trying to convince someone around a topic involving public health. And so I know that anyone who's familiar with primary care will be familiar with this concept, and I definitely won't go into too much of the details, but I think a really nice analog for those who are familiar with it is motivational interviewing. And so when you are trying to talk with a patient about a subject that they may not be super enthusiastic about talking to you about, like smoking cessation, for example, the goal is not necessarily to get that person when they leave your office to set down their pack of cigarettes and never pick it up again, because that's a goal that you're probably not going to meet 99 times out of 100. Instead, the goal is to start to work collaboratively with that person and start to build a relationship that then hopefully over time, you guys can work on meeting a shared goal, whatever that ends up being on the journey to, in this case, smoking cessation. And I think that the concepts that you can see here on the screen that are kind of at the cornerstone of motivational interviewing are very much applicable to delivering a good public health message as well. And so I'm just going to kind of talk through some of those concepts that kind of overlap in these areas. And so probably the first thing you learn about motivational interviewing is that you want to start with open-ended questions. And open-ended questions are really your friend, because as soon as you're asking more narrowly tailored questions, you're very quickly leading yourself to a dead end. So again, coming back to the example of smoking cessation, if your lead question is, would you like to quit smoking cigarettes? You're going to get a yes or no answer, but you're probably not going to get a lot more than that. And so rather than kind of leading a place into a conversational dead end, starting in a place where there's more opportunity for the conversation to grow is really what you're looking to. Because the longer you can get someone talking, the more you can get them to open up, the more likely it is that you're going to get an opportunity to really share your perspective and build on their goals. And so in something like Medicaid expansion, for example, rather than just asking someone like, oh, do you support Medicaid expansion? Leading with a question like, what do you know about Medicaid expansion? Or what are your concerns about Medicaid expansion if you're already familiar with it? That way, even if they're, coming at you with things that you don't necessarily agree with, at least they're the ones doing the talking. They're the ones driving the conversation. And then at that point, now you're engaging with them on a really natural human level and can start to have a conversation rather than just a lecture. And that's really the foundation of where any conversation at least should start. And then building upon that, not surprisingly, the goal with those conversations is to start to build common ground. And, in something like Medicaid expansion, again, if you're interacting with people who are not as gung-ho as you are about expansion, may have some concerns, getting them to talk about, what are those concerns? And so someone may come at you with something like, well, I just have no idea how we're going to pay for this. Like, this is very expensive. There's lots of other priorities in our state or community that I think are more important. And so again, you may not agree with that perspective, but at least gives you that opportunity to be like, okay, so I hear that financial concerns are something you really care about. Well, what if I told you that actually in the states that expanded Medicaid, they're actually seeing reduced costs at the state level because of, decreases in need for uninsured care? Something like that. Obviously, just an example. And depending on, their particular concern, your level of familiarity with the background may differ. And so you may not necessarily have a lot of factoids on hand to persuade them. But anything you can do to start to kind of be like, oh, well, I'm hearing you saying this. Well, I actually agree with you about that. Why don't we talk about like this certain topic? Because again, then even if the person initially thought, oh, there's no way I'm going to agree with this person, you've already found at least one area where you can have a conversation around it. And again, that the longer you keep going, the more likely it is that positive things are going to come of that. And so another kind of part of this that is important to keep in mind that, again, not going to be a surprise to anyone, but I think just always bears repeating, is monitoring your emotions. And this is something that I for sure have to continue to work on as a primary care doctor, because I think anytime you're giving the same message, 10 times, 100 times, 1,000 times, the person you're giving it to might be totally different. They've never heard it before. But you're obviously like potentially meeting the same resistance, the same responses again and again, and kind of, naturally, like very understandably, kind of maybe getting a little frustrated, maybe sometimes being a little shorter than you were the first few times that you gave your spiel. But anytime that you're giving into that frustration, the temptation to talk down to someone, be condescending, start to, maybe, get a little pointed. All of those things are going to result in the person instinctually becoming defensive. And this is just like well established. Human nature is as soon as someone feels like you are coming after them, they're going to put up a wall. And then you're in turn going to put up your own wall to protect yourself. And the next thing you know, the conversation is just at a complete dead end, and no ground can then be made up at that point. And so obviously, you can't you can't be a completely emotionless as you're engaging in these conversations. But I think what can be helpful is after you've done a few engagements, whether it's again with a patient, colleague, a policymaker, media person, and maybe have a sense of like, okay, what are the areas that I know are gonna like maybe get under my skin a little bit? Trying to think of strategies of like, okay, how can I redirect the conversation to either avoid that area, or what can I do to remind myself of like, okay, yes, I know this topic is going to get a little ignite a little passion in me. Need to tamp that down. Need to focus on coming back to the message that I want to give without alienating anyone. Because again, the faster you lose someone, the more likely it is that relationship is going to then take so much more time to repair. And so this is just something that bears repeating because it's something that all of us slip into inevitably over time. But at the end of the day, you've done all your good work. You've used your open-ended questions. You're trying to find common ground. You maybe have some factoids that you can have at your disposal in your toolkit. You're still finding that the person, entity, group that you're engaging with doesn't seem to be picking up what you're putting down. And I know May is fantastic at talking about this and has done a lot of great education around this topic for DFA. But coming back to stories, and I know I caught this at the end of May's tech just now, but it's just so universal how impactful stories can be. And we saw this again just recently with the State of the Union. Every politician brings their guest along with them that tells a story about an issue that might previously have been something very abstract, but now okay, here's Senator so and so with a person from their community who can speak to personally like how this policy has impacted them. And politicians know that that's an extremely effective way to get their point across, and so it is with public health messaging as well. So when all else fails, you want to have that in your back pocket, whether it's a friend, a family member, your own personal story that you can turn to when and certainly okay to lead with it, but I think it's especially valuable to have something in your back pocket, to kind of potentially like get back on with someone. Like maybe you had them initially, you're losing them, bring in a story that's going to immediately engage the vast majority of people and tap into the natural sympathy and empathy that they have when dealing with those sorts of anecdotes. So this is just a really great nugget to have as you're, again, getting prepared to go into different encounters where you'll be sharing information about public health or Medicaid expansion more specifically. And so as I was putting this talk together, I came across this really helpful article that was reflecting back on some communication lessons around public health during the pandemic specifically. But a number of the lessons that they identified, I think, are very applicable more generally and to our topic of Medicaid expansion especially. And so I know I've kind of already alluded to this before, but this will be disappointing to those of us in the health professions, but oftentimes science is just not enough for a lot of people. Even though I gave you some kind of nice little facts and conclusions from research papers here at the start of this talk, for a lot of people, that's just not going to turn the dial very much. So that comes back to, again, like having something like the stories, speaking to values, speaking to shared goals, even if it's not necessarily you're not necessarily maybe engaging with them on the actual science, the health information. There may be other opportunities to engage with someone that speak to something that's a little bit more persuasive for them. And so going into this conversation, again, around any sort of public health topic, knowing that you're not going to be able to just talk about the health, you're going to need to talk about other aspects of the topic. And then again, this will not be a surprise to anyone, but who's delivering the message is so important. And we obviously saw during the pandemic how quickly people can move into their different tribes and start to only listen to messengers that are delivering the things that they want to hear. And so as you go out and start to have conversations around public health or Medicaid expansion, if you know that there are people in your community and whether that's your local town, your city, your state, that maybe cross some of the normal divisions, maybe have a little bit more buy-in, whether that's like a coach from a school school sports team, church leader, community organizer, et cetera, where they may be able to bridge gaps that someone who's maybe more established in a certain community isn't able to do so. Bringing them on board into your campaign is going to be so helpful, because even if they're only giving 70% of the message that you would like them to be giving, if that taps into an audience that you were not reaching at all, that 70% is so much better than 0%. And that's something that I think is important as we move forward, especially in these holdout expansion states where we really need to persuade some folks who maybe have not been super tuned in up to this point. And so finding the communicators who are going to be most able to do that will be helpful. And that, sometimes that means stepping out of the spotlight yourself. And so, kind of in that same vein, having a message and a call to action that is realistic, under the circumstances is important, because if you're talking to people and they know from the get-go that what you're asking is never going to happen, again, it doesn't really matter what you end up engaging them on, they've probably already tuned you out. And so, we've seen that, for these excuse me, states that have expanded Medicaid more recently, Medicaid expansion in North Carolina looks a lot different than it did in Massachusetts or California or Colorado. And I think acknowledging that that is likely to be the case in the states that have not yet expanded, is not, admitting defeat. It's just, recognizing, where are the opportunities and where are the open doors that we're going to actually be able to walk through. And so taking that perspective as you're building your message is important, so that you know that what you're asking of people isn't going to turn them off right from the beginning. And then this was the one that I think did not really work so well, but just wanted to put it in there in case anyone was curious. But the group that wrote this article, kind of advocated in favor of, trying to kind of test out messaging in different groups. I think that obviously in an ideal world, when you have the opportunity to do that, it's great. And obviously you can practice in things like some more supportive communities, talk amongst friends, allies, etc. But at the end of the day, it's going to be tough for grassroots organizers like us to do a lot of like focus groups or tested messaging. So I would say, trust your gut, kind of fall back on some of the principles we talked about today. And, and don't be afraid if you're going to make mistakes, because as I get to in this slide, any sort of public health campaign is almost never successful right from the beginning. And I think we just have to go back to my opening slides and things like seatbelts and cigarettes that, you've come so far, but it obviously took a little bit of time. And, we're already over 10 years, into working on Medicaid expansion in this country. And, we haven't quite gotten over the finish line, but we're at 80%. That's pretty good. So I think that had you said that in 10 years after the Supreme Court decision making Medicaid expansion optional, that we would have, states like Mississippi, really strongly considering expanding Medicaid, I think that people would have been skeptical. So, we're making progress in this effort. It's not even in a place like Texas or Florida or any of the other states that we're still working in. We may still be a little bit away, but we have the opportunity to start building relationships in our communities and with our coalition partners, and expanding that coalition, and using each of these opportunities that we're engaging with folks, whether it's, again, patients, media, policymakers, to kind of see, what's been working. Like when you're engaging with someone and you're talking with them, kind of seeing what are the points that are resonating, because that's something you can use to then build on the next time, with the next conversation you have. And going back and talking with your allies and your coalition partners to say like, hey, what have you guys been seeing that's working? And it's very much an iterative process when it comes to public health messaging, and being willing to kind of scrap the stump speech at times and maybe, come at it from a different angle, depending on who you're going to be talking to. And so would just encourage everyone to keep that perspective in mind as, as we continue down this long but positive journey towards improving health access.
Well, thank you. Thank you very much, Eric, for such an amazing presentation, and for really reminding all of us to tailor our message and the way we talk to the specific audience. So that's definitely very important. And once again, how to balance facts and data with our own stories and with our own experiences. So I think that that's really very important. So thank you so much. And the question that I have is, uh, again, we've been talking about not trying to do things on our own and really join organizations, being part of a group. Uh, my question to you is about social media. We often hear about Facebook, TikTok, Instagram. So, what do you think is the role of social media right now? For example, for such an issue like Medicaid expansion, would that be a worthwhile avenue for people to engage in? And again, not a single individual, but more as a part of a group, an organization. Um, please share with all of us your thinking about that.
Yeah, for sure. And it's a great question. I mean, I think, we have to be open to using social media. That's obviously where so many people are now and getting a lot of their information from. I think my only well, yeah, I'm definitely not an expert myself. But I think my guidance would be to not abandon some of the principles that I talked about here. Because I think it's easy in the social media world, particularly to let your emotions like start to get the best of you. Particularly if you're trying to have any sort of like back and forth with people. We've all seen the Twitter or Facebook comment sections that just like really devolve into very vitriolic kind of things. And there's a lot of like, provocateurs on these platforms that are not going to be interested in having like a good faith discussion on the issues. So I think just recognizing that the limitations of social media prevent kind of some of the more humanistic elements of public health messaging from really breaking through. But I think still using things like stories, potentially, still using things like open-ended questions, that can maybe start a conversation, but acknowledging that there's probably going to be some bad actors that get in on that. But you can still build on the people who do engage with it in a meaningful way. And so I think those opportunities are still there. But the principles I think are still important to kind of keep in mind.